least, I think what we're facing is a national crisis in the Black community. Hello, my name is Michael Randolph, and today I'm going to be sharing with you information about a crisis in the African American community. Black on Black killing and Black on Black violence. Did you know that the rate of killing among African Americans here in the United States is 12 times the rate of other developed countries? During this presentation, we're going to explore why this is the case. And even more importantly, what are the best practice, evidence-based approaches to reducing that number? Did you know that urban violence traumatizes civilians the same way as war affects soldiers? During this presentation, and what is going to be the elephant in the room, as we talk about PTSD, is what's known as intergenerational trauma. This type of trauma affects not only your DNA, but your psyche as well. We're going to devote one presentation to that. But tonight, I just want to focus on PTSD, which is the result of intergenerational trauma. So let's start off with this chart, and it's called streetology. Most of my life has been living in some of the most violent neighborhoods in the country. And I've seen so many people that try to explain why the level of violence is so prevalent in the African American community. Remember, the African American killing rate is 12 times higher than that of other developed countries. So let's talk about streetology and understanding of how we got here. I'm going to start off with why do they kill, starting off with this section, and what contributes to what we call Black rage. The data that I'm presenting is going to be both data-driven as well as evidence-based, so we can come to some understanding of the violent nature and the violent level that's in African American communities throughout the country that are low income. First, it starts off with understanding how we get out here in terms of Black rage, in terms of institutional, structural, systemic racism. All of this led to what resulted in what we call interracial trauma. Again, that's a grown school of psychologists and sociologists who are African Americans that are beginning to address this issue and social connection between slavery and the ongoing violence upon African Americans that has led to this generation of violence. As a matter of fact, Generation Z, Generation Alpha, and Generation Beta are going to be three of the most violent generations that there's ever been. Every generation increased the violence level, and it stems back to what we call intergenerational violence that leads to Black rage. So let's talk about curating the mindset. In that respect, we're going to be talking about the self-fulfilling prophecy. What are the contributing factors that has led to the state of African American communities? So let's start off with economic slavery, which even to this day exists. And when we talk about economic slavery, we're talking about reducing capital to African Americans and creating what is known as the Black consumer. African Americans spend about 1.6 or more trillion dollars every year. And what I mean by that is that we don't invest it, we consume it. That's part of the Black economic slavery mindset. So let's move on. The other key component of the self-fulfilling prophecy is the welfare system. The welfare system actually is part of the reason why the community became dysfunctional. Let me give you some facts. Prior to the welfare system, about 85% of Black families were intact, mother and father. Post-welfare system, even to the point of today, 60% of households had an African American community is headed by single female head of household. The breakup of the family led to the dependency system. Control the culture is the next part of this self-fulfilling prophecy. I call it the curation of the gangster culture. Believe it or not, the gangster culture, in terms of that culture, was paid for by someone other than Black people. As a matter of fact, your private prison institutions control rap music. I'm not saying this. This is what Ice Cube, who's a rapper and is in the industry, made a claim to. I remember looking at on YouTube a piece where a lot of groups got together. And some of those people that got together were from the prison industry, private prison industry, and they were some of the rap industry. And they made a deal there that they would fund the rap projects if it contained violence and anything that would send people to prison. Keep in mind, their invested interest was that they were a private prison. In order to operate, they needed inmates. So they paid for the creation of the hardcore rap movies and TVs. But I also think that this culture of creating the gangster culture started even before then. If you go back and you look at movies like Al Capone uh, 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 let me see, what are some other ones? And Staff is another one of those. But there were so many moves made during that era, which was funded by others in order for blacks to be portrayed as this gangster type of culture, hence curating the culture of crime in part. That led to, with all these images, the street addiction. That explains today why so many people are so addicted that live in the streets to the streets. That then leads to our fourth um, component, which is guns and drugs. When they flooded the community with guns and drugs, that led to the creation of the hood. So that being said, these are some of my ideas relevant to how did we get here. So let's move now to talk more about the impact relevant to intergenerational trauma and PTSD that is rampant in our community, Black community. So what is PTSD? Well, it is a mental health condition that affects individuals who have experienced or witnessed a traumatic event. Research suggests that African Americans and Latinos adults may have a higher rate of PTSD compared to their white counterpart. Additionally, the course of PTSD in these minority groups is often more chronic and challenging. One study found that 63% of Black people thought that having a mental health condition such as depression or PTSD was a sign of weakness or a lack of inner strength. This has contributed to why PTSD is so rampant in our community because of that belief that if we did go and seek help, that's a sign of weakness, which is not true. Now, let's talk about some of the symptoms associated with PTSD. One is an emotional disturbance. Some people exhibit anger, for example, and irritability, and may be easily startled or frightened, or may feel guilt or shame. A person experiencing this may be emotionally numb, depressed. Another symptom is called isolation. People with PTSD often feel isolated. People with PTSD often feel isolated. They may separate themselves from loved ones and experience a decreased interest in life or activities they used to enjoy, which can leave them feeling depressed. So let's talk about what we know. related to the results of Ptsd on our community. Violence in communities affect the fundamental institution of the family and work and education. We are going to talk about a little later on about related to the family. We're going to talk about inter-partner violence. Now, the cumulative social stress, I cannot get this word together. The cumulative social stress has more insidious effect. It has a more insidious effect, undermines people's ability to work or care for their children. I messed that up. In other words, they talk about the effects that it could have on the work or how people take care of their kids. Findings from a large-scale national study indicate that African Americans have a lower risk of many anxiety disorder they have a 9.1% prevalence rate when it comes to PTSD. One study that was completed in 2014 by Michelle stated that PTSD, the PTSD epidemic, is in most violent neighborhoods. Again, I go back to the fact that I've lived most of my life in the most violent neighborhoods in the country. And I see people who experience PTSD and they don't even know it. It becomes part of the norm. So let's talk about this study that was done and how the study is relevant to most Black communities which have a high propensity towards violence. This study was done in Chicago. So Cook County Hospital found that more than 4 in 10 patients screened show symptoms of PTSD, with an even higher rate among those wounded by guns. The prevalence of these psychological ripple effects suggests that in some neighborhoods, I want you to listen to this, in some neighborhoods, nearly every family is touched by traumatic violence. Beyond the direct victims of shootings and assaults, those affected include the loved ones and survivors who actually struggle to help family members cope. Some more information that you should know. And we talk about intimate partner violence. Black females experience intimate partner violence at a rate of 32% higher than that of white female, and about 22% times the rate of women of other races. Black males experience inter-partner violence at a rate of 62% higher than that of white males, and around about 2.5 times the rate of men of other races. I mentioned it earlier. Black Americans are killed at 12 times the rate of people in other developed countries. The COVID pandemic has brought a big increase in murders and manslaughter. In fact, there's data that show that more people purchased guns during the pandemic than any other time in history. Not in history, but in a large number of those were guns, and is the largest in most recent history. So let me go back to here. The pandemic has brought a big increase in murder and manslaughter in the U.S. By accounting of the Centers for Disease Control and Prevention, the homicide rate went from 5.8 per 100,000 in 2019 to 7.5 in 2020. And it appears to have continued to raise, albeit at a much slower rate in 2020 and 2021. In 2020, those identified as Black or African Americans made up 13.5% of the U.S. population, according to the CDC estimates. Now, when you add to that, they made up 55.6% of the homicide, even though we represent only 13.5% of the population. We made up 55.6% of the homicide victims, and 65.6% of the increase in homicides related to 2019. Remember the virus. 2019, we saw a violence that even continued to today. We can actually trace it back to understand when did the level of violence begin to really increase. And we start with the new 2019, and we start with that virus, the pandemic. To put it in another way, the homicide rate for African Americans rose 22.9% per 100,000 in 2019, and 30.7 in 2020. Those numbers even higher now for 2021 and 2022. It has not gone down. It has continued to increase. For all other Americans, the rate went from 3.2 to 3.8. Again, 30.7 for African Americans and 3.2 to 3.8 for all other Americans. Homicide has also gone up faster during the pandemic for those of the Hispanic or Latino origin as well. Among African American homicide rates, were concentrated among one group in particular, the young. That means among the African American homicide rate, the young people in that group in particular was affected. Homicide deaths during the pandemic have been the highest for Black men ages between 18 to 30. That number continues to today. But there has also been substantial increase over the pre-pandemic levels among those groups, couple of years among younger and several older. We're talking about from 15 to 44. What do we know so far from what we're seeing? That violence is prevalent in the African American community. That intergenerational trauma has led to the increase in violence in our community, coupled with, and I need to emphasize this, a poor diet. Research shows that certain foods that you eat increase your chances of acting out. That is, of having a violent propensity. So what do we know? We know that as it relates to solving the problem, it has to be both internally and externally. Internally, that means that we need to really have a conversation about widespread therapy, especially among African American doctors that study this intergenerational trauma. And therapy is important because, again, a large percent of us have PTSD and we don't even know it. That's why therapy is so important. Some of the things that what my research showed when we're dealing with therapy is that in addition to one-on-one therapy with the doctor, there's also things that have helped to lead in the violent propensity that has been embedded in us since slavery. That includes using acupuncture, meditation, incense, sound therapy, visual therapy, and that list goes on in terms of what is being used in order to calm the mind. So let's go back to how do we solve the problem. Let's look at two sets of thinking. One is old school and the other is new school. Old school thinking. Acknowledgement of community violence as a near prime problem. New school thinking view cycles of trauma as a collective social trauma, both as a public health and as a moral issue. Mental health, old school, view mental health as a weakness. New school, no, old school, continue. Use a pharmaceutical approach to mental health. New school uses holistic medicine, homeopathy, including mind, body, and spiritual alternative to medication. The same type of school, holistic medicine, etc., especially mind, body, and spirit, can contribute also to, and that's what research is showing, can contribute to reducing the violent propensity. Meditation is important when we feel that rage coming. So those are some of the things that I just wanted to share with you. We do know in terms of external, there are programs around the country to show what neighborhoods are doing in order to reduce the level of violence. On September the 13th, we're doing a live virtual town meeting to share our public safety strategy on stopping crime. There we're going to hear from people from residents from West Tampa, St. Petersburg, Plant City, East Tampa, Rovers Park, Brandon, Brookfield, Port Richey, Sulphur, Rutland, Lampton, Lakeland, Review, Riverview, Progress Villas, and Wacoff, and other places in the uh, in the city that have already talked about joining us. You're also going to hear about people from around the country that are doing what's known as violent intervention program, in which they intervene in violence to stop the violence. So join us in September for that presentation. The other important thing related to what we're talking about, the title of the upcoming meeting that we're going to be doing is going to be called Community Health, Public Safety, and Social Economic Development, Connecting to the Dot. What we want to show is the connection between community health or lack thereof and public safety and lack thereof and social economic development and lack thereof. To connect all three together to begin to address the issue related to the ongoing, especially Black violence in our neighborhoods. Again, I hope to get an opportunity to meet y'all during our upcoming meeting. The last meeting we gave, we had people from around the nation and even people that was out of the United States that came in to hear about what we was doing. What we did was to bring together 14 communities around the country that were the most affected by violent crime and how they use that strategy of intervening as interveners in violence to reduce the level of violence. Again, we hope you're going to join us. Send us an email at Center for Nonprofit and Community at gmail.com. If you look below on the screen, we've already put our email there. Join us and email us and let us know what you're doing in your part of the world, because you might be part of that best practice lessons learned from around the country. Thanks again, and I hope this information has helped you, because we have to do something. Every day we pick up the paper. Every day we go to social media. Every day we hear about some person of African heritage that's been killed. And it's not limited to adults. Little babies and kids are being killed. And kids are killing kids. And family are killing family. Join us.